tell me about your symptoms first. So what's bothering you?
It's mainly where do I start? It's the low back, and then it runs down into my left leg.
Tell me about 1 to 10. How bad is that pain?
How bad?
How bad? 1 to 10.
Oh, it's definitely a 10. If not blood.
You told me 10 plus,
Yes,
and that's a fair thing.
definitely a 10 plus. There are times when it's just I cannot.
What
take it.
can you do and what can you not do?
It's getting to the point where I really can't do a whole lot at all anymore.
Yeah.
Light housework. I mean, he does all the vacuuming and
Yeah.
all that. I can make meals yet,
But then you're hurting.
but then I'm hurting so at the time that
Yeah.
Sit down
I've got to go
halfway
sit down.
between.
I have a stool in my kitchen so I can get that weight and pressure off my back.
This problem, unfortunately, is not unique to you. It's a common problem. And I'm going to turn around. You have what we call L4-5 spondylolisthesis. You have disc herniation and especially stenosis in that level here, which is significant in the 3-4. But as well, here you see that the bone is falling forward.
Yeah.
We call it spondylolisthesis. This is a common problem. And in a situation like that, first we try to maximize conservative treatment, which is physical therapy and injection, and you did all of that.
I've done it all, yes.
And the pain is still persisting.
Oh, it's just like I said, it's progressively getting worse and worse.
And generally, after we maximize conservative therapy, we go and fix it. A disc is like a tire of a car. Once it becomes this bad, it collapses and the distance between the bone decreases, and that pinches the nerve, and you have all those symptoms. You are weak in the leg, you have radiculopathy that correspond to those levels. So there's not a question that you have a problem and that problem needs fixing.
Yes.
But you saw a surgeon, without mentioning the name.
No, but
Tell me, what have you been told?
basically, it's so bad. Well, he told me there was so much scar tissue in there, arthritis in there, and they'd have to take out all that scar tissue and redo
Everything,
do
yeah.
everything, yeah.
Take 'em out,
And by the
scrape
time
'em.
they take all that scar tissue, we're looking at many hours type
Yeah.
surgery.
And then have to have a heart surgeon stand by.
And then they'd want a cardiologist on standby
Standby,
because,
yeah.
because of my age and stuff.
Okay, and how old are you?
I'm 76.
Okay, but you're a healthy 76.
I am. I'm
Yeah.
basically very healthy.
Yeah.
Because, yeah.
But
it's-
that surgeon wasn't, exaggerating. That surgery for 3-level, in an open old-fashioned way, it is a 10, 12-hour surgery, can be,
Yeah.
Yeah.
and it can be dangerous.
Yeah.
But, that surgeon said, what did he tell you? Did he offer you the surgery, or did he want to send you
No.
somewhere else?
He said, I won't even touch you. We won't even do you around here. And they both, those two, said the same thing. So that's why they said we'd either send you down to Mayo Clinic or the Mayo Hospital or down to the cities.
Okay.
And I don't know where in the cities,
Yeah,
but
yeah.
but wherever, because he said it's just that bad.
That bad that they cannot do the surgery for you.
Right, right.
Now the good news is we do this surgery, what you have just described to you, usually in 1.5 hours. Our patient, 90% of them go home within a day or two. And this is a routine surgery for us. Surgery that, other places, even in big cities and Mayo, if they are told you are too sick for that, this is too big of a surgery, we have a good track record that we perform it even on patient on your age group within 1.5 hours with few ounces of blood loss and send the patient home within a day or two. And that is based on not a handful of patients, that's based on 1,200 patients.
It's unbelievable.
So we can help you. We can truly help you.
That's
Oh, that
best
sounds
words.
great.
I know. It's the best words that I could hear from you.
Yeah.
Answer to our prayers.
Yes, it is.
Thank you. But you have been offered a spinal cord stimulation device. There is not a question you have a bad problem, that you have a spondylolisthesis, you need the big surgery, but the other surgeon offered you spinal cord stimulation device to
Yeah.
just treat the symptom.
Yeah.
Tell me about it. And you have been offered by another place as well, spinal
Both-
cord stimulation.
Both places that I've been to,
Yeah.
that's what they both have wanted me to do. It's kind of like,
Try this first.
Yeah.
yeah, it's something more we can do, but we can't do that for you.
Yeah.
And I just,
See, pain
no.
is a signal that something is wrong. In your case, it's a signal that discs are bad, they are pushing on the nerve, your spine is unstable, and that the symptom, the actual symptom,
Yeah.
is the pain, but that is based on something really bad. Like pain is a noise of a smoke alarm, that there's a fire somewhere. And spinal cord stimulation device, sometimes it helps. It actually, it's like resetting the smoke alarm button.
Okay.
Whereas we need to put the fire out
Yeah.
rather than just treating the
Yes.
noise
I
of a smoke
agree.
alarm.
And that's kind of the way we feel about
Yeah.
that too. I just, and I did have a mastectomy, I had cancer,
Mhm.
but 2.5 years ago. And I have asked my radiologist, or my
Mhm.
oncologist, excuse me, my oncologist,
Mhm.
she really wasn't too happy about me getting, I mean, she wasn't saying definitely, no way.
Mhm.
She just said, I'd rather you not, she said.
Of getting the
Getting
big
the
surgery.
stimulator.
Stimulation device,
Yeah.
yeah, because
Mhm.
that will prevent you of getting an MRI.
That's.
That will truly impede with your
That's-
overall care.
Yeah, and that's what her thinking was too, because
I
I do
mean-
have to have them periodically.
Yeah, and in your case, you're truly having a problem that your spine is unstable,
Mhm.
and treating the symptoms is just going to have very limited effect because truly your spine is moving the wrong way, and just treating the numbing up the nerve is just going to last you for so long, and you have weakness. There's no way that
Yes.
stimulation
Yeah.
device could treat the weakness in your legs
Yeah, it's
Okay.
like a cover-up, isn't it?
for the pain.
Yeah.
For the pain
that's
alone.
what I mean, yeah, and it doesn't take care of the,
Well, I can confidently, based on 1,200 case, tell you, I'm not going to treat the symptoms. We
okay,
can fix your problem,
oh,
and
yeah.
that's based on track record and meticulous data
Mhm.
collection.
Mhm.
And I don't need to send you to Mayo to do that. We do it
That's-
right here
Well,
in your
we live right
backyard.
here, so it's wonderful, we can
Yeah.
stay here, so,
And
yeah.
we'll do the surgery for you in this place, and this is going to be,
Okay.
on average, for what you need, 1.5 hour surgery. Our
Okay.
average patient stays just over the night or so in the hospital. And obviously, in your case, every case is specific,
Mhm.
but we have meticulously gathered our data. We know what the statistic is in
Mhm.
your case, and the
Mhm.
statistic
Mhm.
is hugely in your favor to fix you properly.
Sounds good,
Enjoy
doesn't
that,
it?
though.
Yes, it really
Well-
does.
Any question for me? Any comment? Anything you want to know?
We're so thankful you sent out that brochure
We got
in the
your
papers.
picture at home.
Yeah,
It was about an 8x10 picture and your bio on the back.
yeah.
And we both read it and we kind of looked at each other and like, well, maybe we should try him.
Yeah,
And
yeah.
here we are.
Yeah.
Well, I'm happy you did, and
We
you.
still have your picture. I'll keep that picture.
Well, thank you. Okay, kind
No,
of you.
that means a lot, yeah.
Well-
Her, guy, didn't bring it.
Oh, my chiropractor, I used to go to, yeah. He's actually a good friend of her too, but he said he really wanted me to see a neurosurgeon.
Yeah. Well, we'll fix it for you.
Yeah.
So I can tell them that.
Thank you so much for the interview. Okay, I appreciate that.
Yeah.